Hi everyone, this is Dr. Fred Macy. My approach to men's health is very straightforward. What is my endpoint? To have my patients who are males live a long, healthy life, avoid strokes, heart attacks, dementia, avoid the need for open heart surgery, stents, pacemakers, defibrillators, to live a long, healthy life, knowing who their loved ones are, and to be physically active so that you never end up in the hospital, so that you never end up in a catastrophic situation where you go to sleep one night and don't wake up in the morning. So what does this mean? Diet, lifestyle, that's what it's about. First, you need to recognize who you are. From a family perspective, what is your family legacy? Your father, your grandfather, your grandmother, your mom. Did they have cardiovascular issues? Did they have cancer? You need to know all that and share it with your provider. Once we know all that, together with all your labs, including your hormone levels, your total testosterone, your free testosterone, your estradiol level, your prostate health, meaning your PSA. All of that is important in putting a plan together, short-term and long-term, to keep you healthy and avoid the dreaded complications I mentioned earlier. So, for men, I would like for you to embrace predominantly a plant-based diet, limit your red meat to no more than 2 to 3 times a week, approximately the size of your palm. That's about 6 ounces per serving. No more than 3 such servings per week. Avoid all saturated fats in excess. So I would like for you to avoid also processed foods. What else? Excess sugars, and limit your total sugar consumption to no more than 36 grams a day. That means avoiding sugary beverages, such as sodas, and also try to limit or avoid at all costs diet sodas, since they have other side effects in your gut that are not desirable. Lastly, I need you to exercise and be physically active 30 minutes or more each day, and try to perform some resistance training at least every other day or every third day for 20 or 30 minutes. Having muscles is a good thing. If your hormones are not at the right level, we can try the approach of lifestyle modification first. Avoid tobacco at all costs, because this is a very deleterious risk for both your cardiovascular system, and to prevent cancer, you need to be off cigarettes altogether. Help in that way is available at the clinic. Lastly, if you need medications to control various risk factors that may be out of range, hopefully that will only be for a short time, because by embracing the optimal lifestyle, you will not need medications forever. So the same goes for hormones. Some people are good candidates for hormone therapy, such as testosterone or an estrogen blocker, or others when needed to get to a target level. And again, if you have weight to lose and you shed some of that visceral fat, you may not need these medications forever. My goal is to get you off medications, not to put you on more, by embracing the proper lifestyle. And lastly, if you have an injury of some sort, because you played sports when you were younger, or perhaps an accident at work, or just the wear and tear over the years, then I want you to see a sports medical specialist to help us with those injuries, or if need be, an orthopedic surgeon. I myself have had several arthroscopic knee surgeries that have been extremely helpful, so I can keep on moving. If you divide the world into the men that sit and the men that move, I can tell you who's going to do much better. I want you moving. So I dislike very much orthopedic injuries. And there are other providers that are very helpful. Sometimes colleagues of mine who are urologists may help us if your prostate starts to get a bit large and you're having to get up multiple times at night to urinate. This interrupts your sleep pattern and adds stress to your life, and you become grouchy. So again, we sometimes work together as a team to get you to the best essence of health for you long term. That's my general approach, and I hope you've enjoyed this.